We'll go ahead and get started, and anyone else who's joining us will wander in as they're ready. So we're going to be talking today specifically about using ketamine-assisted therapy for complex trauma and dissociation. And this is a subject that I am very passionate about and is near and dear to my heart. My name is Lauren. I am the co-founder of Inner Path Wellness in Baltimore City. I don't want to talk too much about myself because I've got a lot to share, but I will share, a little bit of my background in case it's helpful. I have been a licensed clinical social worker for about, I feel like it makes me feel really old when I say it. Let's see, 16 years now. So about 16 years. And when I was getting started in the field, like many people, I didn't have a clear direction of who I even wanted to work with. I just started working with everyone. And the different jobs that I kind of fell into, the first was working with youth in the foster care system. And then I worked with youth on probation in Baltimore City. And then I worked at Sinai Hospital for a community outreach program specifically focused on intimate partner violence and domestic violence. So I was just from the get-go exposed to complex trauma. And what I learned pretty early on was that my grad school education did not prepare me for working with trauma at that level. And I felt really limited and I felt a little bit helpless. I was working with people that really were suffering and they needed a lot of help, and I did not feel like I had the tools to help them. So I started looking into everything. I started, listening to any trauma expert out there, like what is actually effective with this? And what I learned pretty early on was that talk therapy alone is not, as many of you here probably know if you're at this talk, is not typically effective alone for complex trauma and PTSD as well. That you actually really need to go beyond talk and the thinking rational prefrontal cortex part of the brain to actually access where the trauma is stored. So that's where I started training in modalities like EMDR, somatic techniques, and later internal family systems. And even before that, I had an interest in psychedelic assisted therapy because I had a sense there was a lot possible by entering into these expanded states, but I didn't quite know all the research. So when I got started in like the late 2000s, I became an integration therapist for a lot of referrals from the Hopkins studies and then referrals from the Shepherd Pratt studies and just a lot of people working with integration. And that really sent me down a road of working with people having psychedelic experiences. And what I was learning was something about these expanded states that these substances produce was greatly healing for trauma when done in safe, supportive ways. And so then I was like, oh my gosh, this is huge. So that led me on a whole path of training in psilocybin-assisted therapy, MDMA-assisted therapy, and eventually ketamine-assisted therapy. And I won't say too much more about that now. I will say that I was very hesitant at first for ketamine-assisted work. I think I had my own bias, against ketamine. And it wasn't until that I really worked with it for a while that I continued to see the amazing results specifically for trauma with ketamine in particular, which is why I'm excited to talk with you all today. So that's kind of what's led me here. I felt so passionate about working with ketamine-assisted therapy and knowing Baltimore did not have a dedicated space for this work that I became a co-founder of Inner Path Wellness, and we opened about 1.5 years ago, which brings me here today. So let's go ahead and dive on in and talk more about this subject. So this is a slide I always love to begin with. Psychedelics, when used responsibly and with proper caution, would be for psychiatry what the microscope is for biology, or the telescope is for astronomy. This is Stanislav Grof. And I really love this quote because, it focuses not just on psychedelics as they're great in and of themselves, but there really needs to be this kind of careful responsibility that's brought to them. And if that careful responsibility is brought to them and that safety is considered, this could actually revolutionize the field of psychiatry and mental health, and I am definitely a believer in that. Okay, so the topics we'll cover today are what is psychedelic-assisted therapy, what is ketamine-assisted therapy, and just to be clear, that's what those abbreviations are. PAT is psychedelic-assisted therapy, ketamine-assisted therapy is CAP. I'm just going to say that now because I'm just going to shorten it because it's a mouthful. And then we'll look at what ketamine actually is. We're going to look at the specific mechanisms of action of ketamine. And then we're also going to look at what is complex trauma and dissociation, what is effective trauma treatment, and why CAP for complex trauma in particular. We're going to spend a little time at the end covering why CAP, why use CAP with other modalities, other trauma-based modalities, and how to choose a CAP therapist. And I apologize. Let me just see if I can, I am so not a Zoom user. So when I use it, I don't know how to see the chat at the same time. So I guess I will be getting to your questions after I'm done the presentation. All right. So let's go ahead and launch in. But if you put them in the chat, I will get to them. So what is psychedelic-assisted therapy? Well, I first want to begin just talking to a moment of what is a psychedelic. And so I think most of us relate to the term psychedelic, we think of substances, and we often think of the classic psychedelics like LSD, psilocybin mushrooms. We often think of maybe mescaline or peyote or these classic psychedelics. But I'm even going to invite you to move beyond that with the term psychedelic. So psychedelic, the root of it is really psyche and delos. That comes from a Latin word, which means to reveal the psyche. And if you can think about it, what we're revealing is the unconscious, what we do not have access to in our normal waking state. And that is what a lot of therapy is trying to do, right? It's trying to help one have access to what is normally off limits, what is normally in the shadow or is exiled from existence. So psychedelic experiences really expand us beyond our limited sense of self. And one thing I'm very interested in is exploring this even beyond substances, that there are psychedelic experiences that happen when we're in nature, when we are in love, when we are in grief from death, when we are in a transition at, a certain time of life. They can actually reveal our psyche. And so another way to think of psychedelics is expanded. It induces an expanded state. It also induces a non-ordinary state of consciousness. You can just kind of use all of these interchangeably. But today, we are particularly talking about psychedelic-assisted therapy using a substance to induce that non-ordinary or expanded state. And today we're particularly talking about using ketamine, and I'll explain why we're focusing on that today. The reason I put these specific substances down is because these are the three that are primarily being studied for assisted work. Psilocybin, MDMA, and ketamine is in clinical use. And so how does ketamine differ from other types of psychedelic-assisted therapy? So one of the main ways is ketamine's duration. A journey with ketamine lasts about 90 minutes, give or take. And this is as opposed to 4 to 12 hours with MDMA, LSD, or these other traditional psychedelics. So one thing I love about that is that actually increases accessibility and affordability. If you're paying someone for 2 hours as opposed to 8 hours, for example, that's a very different kind of situation. The other thing that's unique about ketamine is there's a dissociative mechanism to it, which can help with unblending and reprocessing trauma or other adverse events. And when I use the term unblending, that's really coming from the internal family systems model. So I'm just kind of touching on that now. I'm going to say a lot about that in a little bit. We'll come back to that one. And then it also creates a new orientation and awareness and connection to the body. And now this is a big one that is, it's just intriguing, I think, for many people that a dissociative agent can actually make one more aware or connected to the body. And I will soon be explaining that as well, because that has been absolutely fascinating to me. So what is ketamine? I am probably not going to go through every part of this because we could, talk about every part of ketamine and we only have so much time. But ketamine, we could just say, was first synthesized in 1962. It has a dissociative mechanism. It is not actually a classic psychedelic, but it does cause psychedelic effects, so those expanded state effects in the correct dosage range. So we can use it for psychedelic effects, in other words. In 1970, it received US FDA approval for its use as an anesthetic and an analgesic, and continues to be used around the world as such today. It is a preferred battleground third world anesthetic due to its safety profile, because it does not actually create cardiac or respiratory depression, which is very unique for an anesthetic. So it's actually extremely safe. It has been on the World Health List of essential medicines and continues to be. The interest in ketamine for mental health, such as treatment-resistant depression and anxiety, began in the early 2000s, but it's been more in the last 5 or 10 years that it has really spread, and it's really just beginning to come to the East Coast in this area, especially the Mid-Atlantic area where many of us are located. And so, for example, 2019, the FDA approved S-ketamine. You might have heard of that, Spravato. It's a specific patented form of ketamine for treatment-resistant depression. And so the racemic ketamine that most of us use in ketamine-assisted therapy is actually a generic form of ketamine. It's not typically the Spravato. So unlike traditional psychedelics like MDMA, ketamine has always been legal in clinical legal use since it was synthesized. It's never been, it's always been Schedule 3. Schedule 1 is basically saying there is no therapeutic value. Ketamine has never been put in that category. So that's why we're able to use it. And besides Spravato, it continues to be used off-label for mental health conditions and for CAP, so for conditions like PTSD, etc. One other thing that's unique about ketamine is it can be safely combined with SSRIs and other psychotropic medications. I don't think I've run into one medication since we've been open. I actually work with our medical team to check everyone's medication that comes through InterPath. And there are several medications that attenuate the effects of ketamine, but I've not run into any that are actually dangerous in combination, which is very unusual for a substance that produces psychedelic effects. So people can stay on their SSRIs or psychotropic medicine while they undergo ketamine-assisted therapy. And so ketamine is different, not only from other psychedelics, but also different from other mental health treatments. And these were some of the things I wanted to put in the slide that really stand out to me about ketamine. One of the main ones is that ketamine offers symptom improvement in a few hours to a few days, whereas an SSRI, as many of you know, they don't actually often start working till 4 to 6 weeks later. So if you have someone in severe depression or has active suicidality, that's actually a big problem. And it is not unheard of that some SSRIs for some people can increase suicidality. So it's a little bit like playing Russian roulette for some people, making them wait that long when they're actually not safe. And ketamine in particular can create a dramatic reduction in suicidal ideation almost immediately for some people. Again, nothing's going to work for everyone, but when it works amazingly well and very quickly. There's a wide range of routes of administration, ways that can be administered. It's a generic drug, and so it is more affordable than many patented medications out there. I believe some might know here, I haven't checked the price recently, but I know for lozenges, what I've heard recently for maybe 3 CAP sessions, the amount of medicine that was needed for that was maybe around $80 to pay. So that's a little bit about $25 to add on to the therapy session. So not really that expensive when you consider the overall therapy process. And just saying real quick, some of these studies. So there was a study, this was on treatment-resistant depression, named in the Washington Post in 2022. 72% of the patients in that study saw an improvement in their mood, and 38% were symptom-free after 10 treatments. So that's pretty wild. So you have over a third were completely symptom-free. This is with treatment-resistant depression. This is with people who have tried at least 2 treatments that could be therapy or SSRIs with no improvement. And then the small-scale study I find intriguing, so I threw that in here too. This was a study on healthcare workers, all diagnosed, met the criteria for PTSD, and they were put into an 8-week group. And that group included 3 group ketamine sessions, ketamine-assisted sessions. And after that 8-week group, 86% of the workers no longer met criteria for PTSD at discharge. Now, that was a small sample size, but still quite intriguing. All right, so we're going to jump into some of the mechanisms of action, and I will try to keep this as digestible as possible. Some of this can get a little bit heady, but I also think it's important to name the mechanisms of action, because I know there are some other maybe neuroscience geeks on this webinar as well. And I always love to know why, like, why does something work? And the thing I would say is, ketamine along with psilocybin and MDMA, we have some understanding of how they are working, but it's very small compared to all the things that are there's so much we don't understand. That's all I'm going to say. There's so much we don't understand. Here's a few things we do understand. So ketamine in particular appears to soften the defensive structure or rigidity in clients and allows for greater flexibility. So when you think of trauma, that's often what is compromised, right? Like there is this rigid way of thinking, feeling, even the nervous system is stuck in this rigid state. There's not this flexibility of moving into rest and digest and then back into fight or flight kind of sympathetic mode. Everything is rigid and stuck. And so CAP appears to allow that protective structure to soften. Ketamine in particular also rapidly induces neuroplasticity. It does this through creating physical changes in the growth of neurons and synapses. So neurons are the nerve cells, and synapses are the connections between them. And ketamine does this in 2 particular ways. It causes an increase of brain-derived neurotropic factor, and also increases a glutamate surge, which acts on the glutamate receptors. It also decreases the activity in the amygdala. And so if you know much about trauma and the brain, you know that the amygdala is a key component. It often gets stuck on. It is our threat center of the brain. So it's kind of like when it's stuck on in trauma, it's kind of like having a smoke detector always on. So if you've ever been in a house where one is broken, it's just yelling at you. It is pretty miserable. And that's the way it is with complex trauma. It can be pretty miserable to have this threat center telling you are constantly unsafe, you're constantly under threat. And it's not being turned off, or even if it is, it's constantly being reactivated. So ketamine actually decreases the activity. It downregulates the amygdala. It also downregulates the default mode network of the brain, which is our self-referential network, which is important to have, but it also can keep us very stuck in the same ways of thinking, feeling, and behaving. So it can actually shift us out of that as well. So just gonna touch on these. I could go more in depth, but I just want to talk about how ketamine acts on these certain receptors. So big one is the glutamate receptor. And this is one of the areas that has really been identified as creating beneficial impact, because this increase of activation on the glutamate receptors triggers the repair of atrophied brain regions and creates new neural connection. So when we say atrophy, these are parts of the brain that have been damaged or limited or cut off in trauma. And so what the glutamate actually does is create new connections, which is pretty wild. It's a critical messenger that actually supports functions such as mood and memory. And we'll be talking a lot about memory in a moment and how that relates to trauma. So actually creating and increasing functions such as memory, it's huge in trauma recovery. And glutamate also produces GABA, which blocks brain signals that actually slow activity in the nervous system. So this reduces emotions such as fear, anxiety, and responses such as hyperarousal, which I'll explain more in a moment. I'm throwing a lot of stuff at you guys. Hopefully you're staying with me. All right, so we talked about the glutamate receptors. Let's touch briefly on the opioid receptors. So ketamine acts on both the glutamate and opioid receptors. And what's interesting about the opioid receptors is by activating these, it actually provides significant relief from depression and physical pain without opioid drugs. It also acts to calm activity in the hyper-aroused area of the brain, and again, increasing activity in parts that are atrophied. So both these receptors help in that. And many researchers believe it is the combination of these two acting on the glutamate and opioid receptors that makes ketamine so particularly effective in treating trauma, PTSD, depression, and anxiety. So we just talked a little bit, acting on the glutamate, opioid receptors. We talked about that calming the nervous system. We talked about that decrease of hyperarousal. So if you're a therapist or if you've been in therapy a long time, trauma therapy in particular, you probably have heard of the window of tolerance. And so we'll just bring that in a little bit here because this is an important piece of what we're talking about. So I'll just explain what this is for those that are new to this model. The idea is there is this optimal window in which we function in. When we're in that optimal window, we feel safe, we feel we can engage with other people, we can engage with learning and information, we feel capable, we're able to think and feel simultaneously at the same time. So in other words, we can't actually process trauma unless we are in the window of tolerance. And what happens often in normal talk therapy is someone starts to go into the traumatic memories or material and they get flooded, they get overwhelmed, they move up into that hyper arousal and then they're done. There's nothing therapeutic or reparative that's going to happen at that point. Or they move the opposite way. They get dissociated, numb, and frozen. And again, nothing therapeutic is going to happen when we're out of our window of tolerance. So when ketamine is acting on the glutamate receptors and the opioid receptors, it is actually down-regulating us and keeping us in our window of tolerance. So then when we're bringing up traumatic material, we are not becoming dissociated or overwhelmed and flooded, and we're actually able to process the trauma, which is the missing piece. And so this piece is really important, is by staying in our window of tolerance, and ketamine allows us to stay in the window of tolerance to process the traumatic material that's keeping us stuck in the traumatic response. And I will say more about that because it's an important piece. So let's just touch a little bit on what is complex trauma, sometimes referred to CPTSD. I don't love the D in connection to trauma. I don't love the term disorder. It feels very pathologizing to me. I like to call it post-traumatic stress, a complex post-traumatic stress, because disorder implies that someone is damaged or broken, or there's something really pathologizing about that. And really there is this unprocessed experience stuck in someone's system. There's nothing damaged about them. The system is just holding on to something and something needs to move. But anyway, I diverge. So what is complex trauma? It is really the experience of repeated or prolonged exposures to traumatic events. And the vast majority of complex trauma is going to happen in childhood. So there were extensive traumatic exposures primarily in childhood. And that's important because that was during the time one is developing. Their brain is developing, their system is developing, their relation to self, others, and the world is developing. So this is very different than experiencing a traumatic event in adulthood. So what that leads to is developmental impairments that result from being reared in interpersonal environments that do not adequately support our psychological and emotional development. And so complex trauma meets all the criteria of PTS with the addition of some disturbance of self-organization. Three main symptoms in particular. One is an enduring negative self-concept or sense of self. So this is a lot of rumination, negative view of the self that is kind of all pervasive that you see. It also can lead to ongoing problems in interpersonal relationships and difficulty regulating emotions. So when you think back to that window of tolerance, that is someone with complex trauma is having a lot of trouble staying in their window of tolerance. It is not taking much to send them into hyperarousal or shut down hypoarousal. If we can think of it in this way, their window of tolerance is very thin. It kind of becomes like a toothpick, and it doesn't take much to go outside of it. So what is traumatic dissociation? And I'm going to spend a little time with dissociation because I want to really invite you all to look at what is traumatic dissociation compared to what is dissociation that ketamine induces. So let's start with traumatic dissociation. And the way I like to think about dissociation, excuse me, I'm just going to take a drink real quick. The way I like to think about dissociation is essentially meaning disconnection. And that happens primarily in these three different areas. So number one, disconnection from one's own direct subjective experience. This is what we refer to as depersonalization, but it's really the disconnection from your own experiences. It's a disconnection from your feelings, your thoughts, emotions, sensations. It feels like these don't even belong to you. They're detached. It's also disconnection from one's surroundings. It can be this feeling of feeling distant or the surroundings are distant or unreal. We can't connect. We can't relate to them. There's this detachment that's happening. There can also be this disconnection from other people. And this is a huge challenge. The challenge becomes that there can be an inability to feel that direct experiential bond with others. And so to me, the slide is really important because it also shows how traumatic dissociation is so correlated with suicidality, chronic suicidality. Because when you think about it, connecting to self, connecting to your experiences in the environment, connecting to other people is really like the juice of life. And if you don't feel that, there can be that sense of like disconnection from life even being worth living. So this piece is really, really key. So I'm going to go into now talking a little bit about dissociation induced by ketamine. So when we induce dissociation at any level, and there can be a variety of that depending on dosage, there's really this experiential distance, but instead of in traumatic dissociation, because if you think about it, when traumatic dissociation happens, we are actually in the time of the trauma, and the dissociation was actually, thank goodness it happened. It allowed us to survive. That's why it happened. We couldn't fight, we couldn't flee, so we dissociated. And yeah, that was our survival strategy. That was very important at that time. Now, when we continue to dissociate, that's typically because there is some kind of trigger or association or something is going on that feels connected to the trauma. And that dissociation, the traumatic dissociation, is really allowing us to move away, to avoid, to kind of cut off, because otherwise we would be flooded or overwhelmed. So what we're doing with dissociation in ketamine is we're actually doing the opposite. Instead of moving away from, we're moving toward. We're using that experiential distance or detachment to face and resolve traumatic material by not becoming overwhelmed by it. So if you reflect back to that window of tolerance, we're using the dissociation that ketamine allows to stay within our window of tolerance. So then when we're bringing up traumatic, and I say traumatic material because it can be more than memories, it can be body-based sensations, it can be emotions, it can be beliefs and thoughts, it can be on so many levels. When we're bringing up the unprocessed traumatic material, we're able to actually process it and not get overwhelmed by it. And that's really the key in trauma healing and recovery. Also, ketamine's neuroplasticity that we talked about, that growth of new nerve cells, synaptogenesis, that connection between the nerve cells, is helping with that as well, because it's actually helping those areas that were damaged by trauma, such as the hippocampus, amygdala, etc. I'm throwing a lot of information at you guys, and I get that. So just to say, please, as you have questions, type them in so you don't forget. I love questions, and I'm happy to answer. And I was just looking at the time, I better feel like I speed it up a little bit so we can get to questions. But I will say real quick, I'm showing you this image. This is obviously an astronaut on the moon. And the reason I threw this image in there is because it's a metaphor I really like to use to explain why the dissociative aspect or quality of ketamine is so effective for treating traumatic dissociation. And so if you think about it, if you're a traveler, if you've ever traveled to a country that's very different from your own, um, there's really this experience of once you travel back, say you're American, if you're, or at least you live in the US and you travel back here, there can be really this experience of witnessing or experiencing it for almost the first time. You see it in such a different way. I know I had this experience in my early 20s. I lived and worked in Nepal and India. And so I would be gone from the US for a year or two, and then I would travel back. And I remember, even though I grew up in the US, I would look around and just notice like how orderly everything was, how clean everything seemed, how the traffic was not complete chaos as opposed to where I was in those regions. And so I remember it was like as if I noticed and saw it for the first time. It gave me this whole different relationship to this place that, was just so normalized for me. And as a more extreme version, you could imagine as an Earthling, if you were to travel to the moon, astronauts have talked about this and seeing Earth for the first time from that perspective. It changes you. It's a whole different perspective. And when you re-enter the Earth, that's never going to be taken away from you. So I say all that to say, when you go into ketamine-induced dissociation, it actually takes consciousness awareness further outside of the body, and kind of like a pendulum, the way you would pull something back, and if you pull it back to the left, as you release it, it'll go further to the right. So the further you actually move into this detached state, as you come into this re-entry period in ketamine, of connecting to your body, of dropping back into your physical embodiment, what I have noticed and what other therapists have noticed is that there is actually more awareness in that same way of traveling to another country or traveling to the moon, of the sensations in the body, of urges, of hunger, all these things that can go offline when we're living from the neck up, as what happens in trauma. And so there's really this power, like a pendulum, of moving in the opposite direction, so that when we move back into the body, we have this potential for more awareness and embodiment, which I find so exciting. And so this is exactly what I was talking about. A lot of times we can think of it like a paradox. We are moving further into a dissociative state to actually treat the dissociation. And this happens all the time. We see this in homeopathy, with that idea of like treats like, with vaccines, of actually ingesting some of the antigen to help mount the immune response. And if you've ever been in a yoga class or something like that, where there's been progressive muscle relaxation, where you actually cause more tension in the body, And you're not causing more tension to add more tension to the body. That's not the goal. It's actually causing more tension. So when you induce that tension and then release the tension, there is more release and relaxation. There is something about moving further into the thing that we want to treat that moves us out of it. So I hope that helps to understand that a little bit more. Happy to answer questions about that. Okay, so to touch on briefly, effective trauma treatment. What is that? And what does that even look like? Well, first we have to talk a little bit about what is trauma. And so really trauma is really these stored reverberations, these ways that this unprocessed experience is coming out. And so we can't just treat the symptoms. We cannot just treat the symptoms. That might be a helpful interventions. Taking SSRIs might help with the depression. We could take, anti-anxiety meds. There's things that could be helpful. We can also do some cognitive restructuring work, reframing work. That could be helpful, but really we're just treating the root. In order to actually heal trauma and work with trauma, we must go to the root, which is actually processing these unprocessed experiences that are in us, whether it's the memories, the beliefs, the stored survival energy that's in our bodies. Similar to our digestive tract, these experiences must be digested, processed, and integrated. If they are not, they will keep coming out sideways. All the different ways, through hypervigilance, through dreams, through flashbacks. These are the ways that unprocessed trauma comes out. And so we have to move the traumatic material, the stuck material that's keeping us in the past. What we call that kind of memory is implicit memory, and we have to move it to explicit memory through trauma processing and memory reconsolidation. So I'll say a little bit more about what those things look like. I'm actually going to skip these parts so we have more time to ask questions, but this is just from a scientific write-up. This was a meta-analysis combining ketamine and psychotherapy for the treatment of PTSD. Yeah, it's basically saying there's a lot of potential, just to sum it up. This is another scientific review. This one focused specifically on a single infusion of ketamine. So this was not even with therapy, which is literally with one ketamine infusion. And what was found was that in these kind of sub-aesthetic doses, which is what we use in ketamine-assisted therapy, it really does regrow nerve cells, proliferate brain cells, and grows the connections between, which are all essential in memory reconsolidation, which is what is needed in trauma healing. So I'll just talk about these specific ways that ketamine acts on our system that are complementary or helpful in healing trauma. So if you are a therapist and you work with the nervous system, or you've studied polyvagal theory or any of this kind of stuff, you probably know a lot about the nervous system and know it has a key component in the traumatic response. So when we talk about hyperarousal, we're really talking about nervous system states. And so what is key in healing is that we downregulate the nervous system. It's typically stuck on. And we have to do that by deactivating the amygdala, again, that smoke detector, so that we have that distance and that we don't become overwhelmed by the emotions and the sensations from the traumatic memories and material, so that we don't become overwhelmed in the trauma healing. If we become overwhelmed, again, it's no longer therapeutic. And so ketamine downregulates the nervous system. It is a parasympathetic activator. It keeps one out of that activated sympathetic response so one can effectively process trauma. This is the piece that gets me so excited. I know it's a big word, memory reconsolidation. Basically, what memory reconsolidation is it's really coming from this understanding that our memories, and I really want, if you take something from this talk, to understand when we talk about traumatic memories, we are not just talking about an image in the mind, like literally what we saw or sensed through the five senses. We are also talking about the body-based sensations, the emotions, the beliefs, all the things that were happening at that time that we are reliving in the present. And so when we say memories, we are talking about all of that that's connected to the trauma. And what we know is that memories are malleable, they are changeable. And with trauma, we have to change them. The way they're stored right now are implicit. And if they keep coming up, it's going to be like they're happening again. And that's what PTSD or complex trauma symptoms are. So every time, this is fascinating. So every time we retrieve a memory, it gets imprinted with the associations of the retrieval. So what that means, if I recall, let's say I'm in, a ketamine assisted session for myself, and I recall, the time that I was kind of abandoned on the playground and my parents didn't come to get me for a really long time, and I cried and it was scary and I didn't feel safe and I was overwhelmed. So if I recall that memory in this atmosphere with more compassion for myself, where I am experiencing this memory where I was so alone and scared, but I'm not alone because I'm partnered by a therapist that I trust. My nervous system is down regulated, so I'm able to stay present. So with these different body-based, emotional, cognitive, and interpersonal associations, they actually change the way the memory is stored. And this allows for the memories to be desensitized, to uncouple from the emotions that they're stored with and be reprocessed so they're actually stored differently. So it's so fascinating to me because I think a lot of times we think of memory like, if our mind was a big library, it's like we put a book on the shelf, we could leave it, for a month and we come back and it's exactly the same. But every time we pull that book from the shelf, it actually changes because it becomes coupled with how we remember it. So this is actually how we heal and shift trauma, is through memory reconsolidation. And so I'll just touch on this briefly. One of the principles of psychedelic assisted therapy and CAP is that there is this wise part of us. There is this knowing, intuitive part of us that is just essential. It is never broken. It has never been disturbed by the events of this world, by intergenerational trauma, and it knows instinctively what we need to heal. It's kind of like if you cut your arm and all the blood cells rush there to heal the cut or the wound. You don't have to think about that. You don't have to make plans. You don't debate about it. It's literally this wisdom that your system has. So we believe this in psychedelic work. We believe that there is this intuitive intelligence that exists within you. And when we can get that cognitive, that prefrontal cortex quieted down some, this intelligence can come through and actually guide the healing process. And it knows exactly what you need. And this is so important because experiencing trauma is inherently disempowering, and it really takes away one's sense of control. And it also takes away one's sense of trust in themselves, other people, and the world. And so trauma recovery must restore one's sense of trust in their own self and their intuitive knowing. And another component of going through CAP with a therapist that is trusted is it begins to have those reparative experiences with another person as well in that interpersonal relationship. So I won't talk about this because of time. This is the first time I'm doing this presentation. I'm like, oh, as usual, I threw way too much in here. So if anyone has questions, I can speak about the difference between infusion centers and ketamine-assisted therapy. I'm gonna skip that quote. I'm just gonna briefly, without going through the slides, just touch on combining CAP with these other modalities. So these three modalities are all modalities I really connect to, I use as a therapist, and all are evidence-based for trauma and complex trauma. And I believe, and many others believe, they fit beautifully with ketamine work. And so, for instance, with internal family systems, this is parts work, is ketamine really allows this dissociative quality, this ability to unblend the self from the part so that we can have that self to part relationship. Within the IFS modality, that is the healing agent. And so ketamine helps. IFS is effective on its own, but adding ketamine in can really speed up the pace of recovery and lead to more lasting effects. And Dick Schwartz, who really is the founder of the IFS modality, is a huge proponent of ketamine-assisted work. You can find him teaching on it. You can see videos of him, excuse me, facilitating involving low-dose ketamine with IFS. To touch briefly on integrating somatic therapy, hopefully from my previous slides, that should be even obvious why that is such a good combination, excuse me. But CAP can allow one to explore and feel sensations in the body without becoming flooded or dysregulated. So again, staying in that window of tolerance to begin to experience the body. I mentioned before, but typically when we are living with ongoing trauma, we are living from the neck up. We are all in our heads. That is the place we feel safe. The body is no longer safe. And so a big part of trauma recovery is beginning to become embodied again. If you've read or follow like Bessel van der Kolk's work or Peter Levine's work, it is all about trauma needs to be treated with bottom-up interventions, body and embodiment interventions, somatic-based interventions. And so in a big way to experience those is to not get flooded, again, to stay in that window of tolerance. There's also this idea that trauma lives in the body, right? So the survival stress at the moment that many of us were traumatized, or the moments, we had all of this activated neurotransmitters and hormones, stress hormones like cortisol and adrenaline. And if they weren't properly released, they just get stuck in the body and they keep coming out sideways through anxiety, through panic, through vigilance, through nightmares, through all this other way. And so we have to release the survival stress in the body. And so again, ketamine can help us stay down-regulated enough that we can actually release that survival stress. And I'll just touch on briefly EMDR in relation to CAP. And I know many of you probably know what EMDR is. EMDR stands for, there's a lot of mouthfuls in this presentation, probably why I have to keep getting a drink. EMDR stands for eye movement desensitization and reprocessing. And so quite a mouthful. So EMDR with CAP, it's a really beautiful combination with low-dose ketamine, because the support of ketamine, again, allows one to not become flooded and to move memories from that implicit, stuck state into explicit, which is the process that needs to happen. That increase of neuroplasticity allows us to begin to integrate the more adaptive feelings, beliefs, and experiences to be stored with a memory. So that's that memory reconsolidation we were talking about. So that can change, for instance, a common belief in complex trauma is that something's wrong with me. I'm a bad person. And so that shift from I'm a bad person to, for example, bad things happen to me is everything in trauma recovery. And so to be able to really pair that with the experiences of the past simultaneously can lead to that shift from implicit to explicit memory. And then in EMDR, we often use resources to help with the deficits that were there at the time. So if one grew up and they did not have an attuned, consistent caregiver, we might invite in like an ideal mother or other kind of caregiver. And it doesn't matter. People get stuck on, well, that didn't happen, so that's not real. But it doesn't actually matter what's real with the way we store memory. So if we actually bring that in and pair that at those moments when we actually felt alone, like my example in the playground, being left at the playground, if I actually brought in a caring caregiver that was there with me and could be there, that will actually change the way I store that memory, and therefore will generalize to all the ways that's affecting me in my life today. So I'll just touch briefly. I know it's 6:56. I am happy to hang out for questions, obviously longer than 3 minutes, as long as they take. But I'll just say briefly, because ketamine work is so vulnerable and you're in such an open state, I actually think it's really important to consider who you're working with and how you're working. And just a side note, this is why I'm hesitant for a lot of people to work with infusion centers, because in these open states, if you're not really fully partnered and supported during that journey, it could go okay. And usually it does, but sometimes it doesn't. And that can be re-traumatizing. And especially with trauma, I really don't recommend doing an infusion center where you are not supported the entire time. So if you're working with a CAP therapist, some of the things you want to consider: have they received training in psychedelic work, ketamine work? Will they be present with you throughout the entire time? That is really important because, again, most trauma, especially developmental and complex trauma, is trauma of not only experiencing adverse traumatic events, but being alone in those events. So the reparative experiences is actually being partnered in the trauma healing. Do they have training in trauma-informed care? That's really important. Do they have personal experience with what that means with non-ordinary states of consciousness? If they're leading you into a territory such as ketamine-assisted work, have they been in those states themselves? I actually think that's really important. Do you feel safe with them? That is so important. You know, they might have all the trainings and the credentials, but there's something that feels off. That's your intuitive knowing. Trust that. You should, and it's, if you don't feel safe with anyone, you might not feel totally safe with them at first, but there's the sense of, I could feel safe with this person. Do they come from a holistic perspective? So they're considering the mind, the body, and consciousness or spirit, even outside of that. And do they allow your input in the CAP session and protocol? So this is really important because, again, trauma is inherently disempowering. So part of the healing is actually being empowered to choose and guide your own session. And do they prioritize integration? We didn't even have time to talk about integration, but integration is a huge part of trauma treatment and psychedelic therapy in general. Oh, I had so many takeaways to share. I'll keep them up as we begin to move to questions.